Welcome back, everyone. You are listening to another episode of Fast Facts Perio Edition, brought to you by A Tale of Two Hygienists in partnership with Dentist RX. And now, please welcome your host, Katrina Sanders.
Hello, and welcome to Fast Facts Perio Edition. And we're back, you guessed it, to continue the conversation about AAP staging. Last week, we looked at stage 1 periodontitis and how we classify patients that are standing on that borderland between gingivitis and periodontitis. This week, we talk about stage 2 periodontitis. And I want to be very clear. When we talk about stage 2 periodontitis for our patients, we're specifically talking about patients who have likely been residing in a stage 1 periodontitis situation and have now experienced, as the Academy calls it, established periodontitis. Specifically, our Academy indicates that a carefully performed clinical periodontal exam will identify the characteristics that this periodontitis has caused in damage. At this stage in the disease process, this clinical periodontal exam will show us a few things. Number one, maximum probing depth anywhere in the mouth will be 5 millimeters. And again, I want to be clear, this 5 millimeter is a true 5 millimeter pocket, meaning we do forgive anywhere between 1 to 3 millimeters of a relatively healthy and subsequently cleansable sulcus. The idea being that if this is a 5 millimeter pocket, not due to hyperplasia or tissue overgrowth or fibrosis, but actually due to apical migration of the junctional epithelium, the clinician will observe anywhere between 3 to 4 millimeters of interdental clinical attachment loss. Aside from probing depths, and I want to be very clear, yes, our clinical assessment can absolutely help with some of this. However, we may also see radiologic bone loss. This will be anywhere between 15 to 33%, meaning the coronal third of the root will experience or be involved in a radiologic bone loss experience. If there is any radiologic bone loss, the Academy indicates that the patient will be presenting with mostly horizontal bone loss. And this particular patient has also not lost any teeth due to the periodontal disease process. Now, patients that are in a stage 2 periodontitis situation, the Academy specifically states that at this stage, management does remain relatively simple for many cases because we can apply standard treatment principles like regular professional and personal bacterial removal and subsequent monitoring in order to arrest the progression of the disease process. Therefore, the Academy states that patients that are in stage 2 periodontitis have an opportunity for clear intervention and subsequent monitoring. However, the Academy also advises that careful evaluation of our stage 2 patient's response to standard treatment is essential. And of course, we watch for grading, which we're going to take a look at in a moment, that may help identify the patient's response or lack thereof, which may guide us to move the patient into more intensive management if needed. Stay tuned as next week we unpack stage 3 periodontitis. This has been another episode of Fast Facts Perio Edition with Katrina Sanders. Please feel free to reach me on Instagram at The Dental Wine Genist or on my website, www.katrinasanders.com. Cheers.
Thank you for listening to another episode of Fast Facts Perio Edition, brought to you in part by Dentist RX, makers of the IntelliSonic line of power brushes. Find out more by visiting their website at dentistrx.com. We'll see you next week for another Fast Facts.